What if your body has been sending you warnings about diabetes, and you have been brushing them off every single day? Before any blood test, before any diagnosis, the evidence may already be showing up right on your feet. And what I am about to walk you through today could completely change the way you think about your health. Most people are convinced that diabetes can only be detected through a blood test. You visit your doctor, the lab results come back, and that is when you find out. I understand why people believe that. For a long time, that is what most of my patients assumed as well. I'm Dr. Dan Carter, and what I have observed, what I see confirmed in my practice week after week, is that your body begins signaling elevated blood sugar long before any lab work ever picks it up. And the very first place those signals appear is your feet. The reason I wanted to make this video is because of how many patients I have watched walk into a clinic, or worse, into an emergency department, who had every single warning sign for months, sometimes years, and had no idea what they were looking at. I want to change that for you today. Just recently, I sat down with a patient. A 67-year-old man, retired, generally healthy lifestyle, felt perfectly fine. He came in for a routine visit. But before we ran any lab work, I asked him about his feet. He told me, "My feet have been kind of numb for a while now. I just figured that was normal for my age." He had 4 of the 9 signs I'm going to show you today. His fasting blood sugar came back at 214. He had been diabetic for over 2 years and had no idea. So today, I want to walk you through exactly what I showed that patient. 9 signs that were already visible on his feet, and on the feet of millions of people right now, that almost no one recognizes for what they truly are. For each one, I will tell you what most people assume it is, what is actually happening inside your body, and one straightforward daily habit that can help protect you. The American Diabetes Association estimates that roughly 1 in 5 Americans living with diabetes are completely unaware they have it. That is over 8 million people going about their daily lives with a silent condition quietly doing damage to their nerves, their kidneys, their eyesight, and yes, their feet. The encouraging part is that a basic blood test, around $12, can catch this early. But first, you need to know what to watch for. Let's get into it. Sign number 1 is something nearly every patient has already experienced, and every one of them has found a way to explain it away. Tingling, numbness, that pins and needles sensation in the feet. My patients almost always say the same thing. "Dr. Carter, my foot just falls asleep sometimes. I was sitting with my legs crossed." And sure, that happens to everybody now and then, but I always follow up with one question. Is this happening on a regular basis without an obvious cause? Because if the answer is yes, we need to look deeper at what is actually going on. Frequent, recurring numbness or tingling in the feet, what physicians refer to as peripheral neuropathy, is one of the earliest indicators that blood sugar has been running high for some time. The excess glucose in your bloodstream gradually attacks the protective outer layer of your nerves. It is a slow process, which is precisely why most people overlook it. I explain it to my patients this way. Picture your nerves as electrical cables. Each cable has an insulating layer around it. That insulation is what allows signals to travel cleanly from your brain all the way down to your foot. When blood sugar remains elevated, it acts like a corrosive agent slowly eating through that insulation. The cable still functions for a while, but the signals start arriving distorted. That distortion is the tingling you feel. According to the American Diabetes Association, peripheral neuropathy affects close to 50% of people with diabetes. It is the single most common complication, and it nearly always begins in the feet. That means right now, tens of millions of people are experiencing this tingling and dismissing it as nothing. Do not be one of them. My recommendation for every patient over 60, a 20 to 30-minute walk every single day. Not a run, not a jog, a walk. Movement is the most effective thing you can do to keep blood circulating to your feet and to preserve those nerve endings. And begin reducing added sugar in your diet today. Not next month, today. Sign number 2, and this is the one my patients describe as the most unsettling of all, because it does not strike during the day. It comes at night, when they are alone and trying to sleep, and there is nothing to take their mind off it. A lot of my patients attribute this to being on their feet all day, or the summer heat, or just general tiredness. And sometimes that is exactly what it is. But when a patient tells me their feet feel like they are burning, especially at night while lying down, that gets my full attention. A burning sensation in the soles of the feet, particularly at night, is a textbook early sign of diabetic neuropathy. Here is what is happening. The nerves in your feet have sustained damage from excess glucose, and they have begun sending incorrect signals to your brain. Your brain receives a message that says heat, even though nothing hot is touching your foot. The nerves are misfiring. Think of it like a smoke detector with a faulty sensor. The building is not on fire, but the alarm keeps going off because the sensor itself is broken. Your nervous system is doing the same thing. The burning is not coming from outside your body. It is coming from damaged nerve tissue that is sending distress signals. Research published in Diabetes Care found that burning foot pain is one of the earliest reported symptoms in patients who are subsequently diagnosed with type 2 diabetes, often appearing 1 to 3 years before a formal diagnosis is made. 2 habits I suggest for this one. First, make sure you are drinking at least 8 glasses of water daily. Proper hydration helps your kidneys clear excess glucose and supports nerve tissue health. Second, add more fiber to every meal. Vegetables, legumes, oats. Fiber slows the rate at which sugar enters your bloodstream, which is exactly what those struggling nerves need. Sign number 3, and I need you to pay close attention here, because this is the one that crosses the line from uncomfortable to genuinely dangerous. This is the sign that sends the most patients to the emergency room. They come in and say, "Dr. Carter, I had a small blister from my shoe about 3 weeks ago. It still has not healed." They waited. They assumed it would close up on its own, and most minor wounds do heal on their own, but not when blood sugar is elevated. When blood sugar remains consistently high, your body progressively loses its ability to repair itself. The blood vessels throughout your body, including the tiny ones in your feet, begin to narrow and stiffen. This means that oxygen, white blood cells, and the nutrients responsible for tissue repair simply cannot reach the wound quickly enough. The wound just sits there, open, exposed, and painfully slow to close. Think of it like trying to water a garden through a hose with a severe kink in it. The water exists, but it cannot get where it needs to go. That is precisely what elevated blood sugar does to the circulation in your feet. The healing components are there in your blood. They just cannot reach the wound. And an open wound that refuses to close is an infection waiting to happen. The Centers for Disease Control reports that diabetic foot ulcers are the leading cause of non-traumatic lower limb amputations in the United States, over 100,000 per year. Nearly all of them were preceded by a small wound that was ignored. After your shower tonight, sit down and examine both feet carefully. Look between every toe. Check your heels. If you see any cut, blister, or broken skin, clean it with mild soap and water. Apply an antiseptic and cover it. And if it is not improved within 48 hours, call your doctor. Not next week. 48 hours. Sign number 4, and this one is hiding in plain sight. Most people walk past it every day without realizing what they are looking at. It is visible. It has been there, and almost nobody connects it to blood sugar. Patients see their feet turning darker or taking on a reddish tone, and they tell me, "I think it is just sun damage," or "I have always had darker skin on my ankles." And that may be true, but there is a specific pattern of discoloration, particularly around the ankles, that I am trained to look for when evaluating blood sugar risk. When circulation is impaired by elevated glucose, the lower legs and feet do not receive adequate fresh, oxygenated blood. The skin changes color as a result. You may notice darkening, a deep reddish hue, or even a bluish tint around the ankles. This is your skin telling you that blood flow to that area is insufficient. In some patients, the skin in those areas also becomes thinner and more fragile, another indication that the tissue is not receiving proper nourishment. I always explain it this way. Think of your blood as a delivery service carrying oxygen and nutrients. Your feet are at the end of the longest route in your body, farther from your heart than any other part. When the roads narrow due to damaged blood vessels, the deliveries stop arriving on schedule. The skin, deprived of fresh oxygen, changes color. It is a distress signal you can see with your own eyes if you know what to look for. A study in the Journal of the American Academy of Dermatology found that these skin changes are detectable on average 18 months before a formal diabetes diagnosis. The daily habit here: 5 minutes of ankle circles, toe raises, and calf stretches every morning. Even that small amount of movement drives blood into your feet. And if exercise is difficult for you, simply elevating your feet slightly while you sit can make a meaningful difference. Sign number 5. And this one surprises my patients the most because it appears completely harmless. In fact, most people have dealt with it for years and never once linked it to blood sugar. Dr. Carter, my heels crack every winter. It is just dry skin. I hear that constantly, and yes, cracked heels are extremely common. But when your heels are splitting badly in the middle of summer, or no moisturizer seems to help regardless of how much you apply, that is a completely different situation. Diabetes can damage the autonomic nerves, the ones that regulate automatic functions you never have to consciously think about. One of those functions is controlling moisture and sweat production in the skin. When these nerves are compromised, the sweat glands in your feet stop working properly. Your feet lose their natural moisture from the inside out. No amount of lotion addresses the root cause. Think of your skin like a brick wall that needs to remain sealed. When those autonomic nerves are damaged, the mortar between the bricks begins to crumble. Cracks form. And those cracks in the skin of your feet are not just a cosmetic issue. They are open pathways for bacteria and infection. In a foot with poor circulation, that infection can escalate very quickly. I have seen patients come in with cracks in their heels so deep they were bleeding, and they told me they had been applying lotion for 2 years with no improvement. That is not a skin problem. That is a nerve problem. The American Podiatric Medical Association identifies chronic, treatment-resistant heel cracking as a significant indicator of autonomic neuropathy in older adults, a condition directly tied to prolonged elevated blood sugar. Moisturize your feet every night before bed. A quality lotion or pure coconut oil works well. Apply it thoroughly to the sole and heel, but never apply moisturizer between your toes, as trapped moisture in that area breeds fungal infection. And drink 8 glasses of water daily. Your skin needs hydration from the inside just as much as from the outside. I want to pause here for a moment. We have covered 5 signs so far, and I want to ask you something directly. Have you noticed any of these signs in yourself? Or in someone you care about? A spouse, a parent, a sibling? If the answer is yes, even just one sign, go to the comments right now and type the word yes. Just yes in capital letters. That is all I need. I read every single comment on this channel, every one. If you have a question, ask it. If something concerns you, tell me. That is why this channel exists, not to talk at you, but to have a conversation with you. And if you are finding this useful, hit the like button right now. It takes 1 second, and it signals YouTube to show this video to more people over 60 who need to see it. Alright, let's keep going. Sign number 6. And this one is more serious than most people realize, because it is not just about your feet. It is about what is happening to your kidneys at the same time. Nearly everyone I have seen with this tells me, I sit at my desk all day, or I stand on my feet for work. Occasional swelling from prolonged activity is normal. I want to be clear about that. But if your feet and ankles are consistently swollen, and you are leaving deep sock impressions every evening, that changes the picture entirely. Elevated blood sugar affects the kidneys. The kidneys regulate your body's fluid balance. When kidney function is impaired by years of high glucose, fluid accumulates in the lowest point of your body, your feet and ankles. This swelling, called edema, is a sign that your body's filtration system is under strain. Think of your kidneys as the water treatment plant for your entire body. Every drop of blood passes through them to be cleaned and balanced. When high blood sugar damages those filters, the system backs up. Excess fluid has nowhere to go except downward. Gravity does the rest. The fluid settles in your ankles. You press a finger into the swollen area, and the indentation lingers for several seconds. That is called pitting edema, and it is not something to brush off. The National Kidney Foundation reports that diabetic kidney disease affects approximately 1 in 3 adults with diabetes, and lower extremity edema is frequently the first visible sign that kidney function is being compromised. When you rest, elevate your feet above the level of your heart, even a few inches on a pillow. This helps redirect the accumulated fluid back toward the center of your body. And reduce sodium in your diet. Salt causes your body to hold on to water, which makes edema significantly worse. Read labels carefully. Many canned and processed foods contain far more sodium than people expect. And if the swelling is new, persistent, or worsening, bring it to your doctor's attention at your next visit. Do not wait for it to become a bigger problem. Sign number 7 is the one I see most often misdiagnosed. Men, especially. And by the time they discover what it actually is, they have been living with it and masking it for years. What I hear, almost without exception, is this. I have been taking ibuprofen for the foot pain for months. I assumed it was arthritis, maybe an old injury. I have heard this story dozens of times, and sometimes that is exactly right. But sometimes the pain has a completely different origin, one that ibuprofen will never touch. When nerves are damaged by chronically elevated blood sugar, they do not always go quiet. Sometimes they become hyperactive. Instead of going numb, they begin firing random, intense signals that your brain interprets as severe pain. Patients describe it as stabbing, like an electric shock, or a hot needle being driven through the foot. It happens most often at night, when there are no other sensory distractions. Think of a car alarm that got damaged in a collision. Every few minutes it starts blaring for no reason. Nobody is trying to break into the car. The alarm system is simply broken. That is exactly what a damaged nerve does. It sends alarm signals to your brain when nothing is actually happening. The pain is entirely real, but its source is nerve dysfunction, not physical injury. And taking ibuprofen does not repair a damaged nerve. What it does is suppress a signal your body is urgently trying to send you. Suppressing signals is the last thing you want to do when your nerves are asking for help. A landmark study in the New England Journal of Medicine found that painful diabetic neuropathy affects roughly 25% of people with diabetes and is frequently mistaken for arthritis, tendinitis, or age-related joint pain. Every morning, spend 5 minutes on gentle foot and ankle stretches before getting out of bed. Flex your feet, circle your ankles, pull your toes back gently. Get blood moving before you put any weight on your feet. And every night before bed, give your feet a gentle 3-minute massage. Light circular strokes along the sole and up around the ankle. Your nerves will respond. Sign number 8 is the one that tells me how far things have progressed. When I see this in a patient, I know we are no longer in the early stages. And nearly every time, the patient's first reaction is, "Doctor, I have had that my whole life." They say, "I have always had cold feet, Dr. Carter. My wife has been stealing the electric blanket every winter for 30 years. And I laugh along with them. But then I ask, "Are your feet cold in July? Are they cold under 3 blankets?" Because that is when it becomes a concern. Cold feet that persist regardless of the temperature around you. Cold in summer, cold under heavy blankets, cold even when the rest of your body feels perfectly warm, are a strong indicator of significantly reduced blood circulation in the lower extremities. Your blood vessels have narrowed or stiffened to the point where warm blood simply is not reaching the tips of your feet in adequate volume. Think of your blood vessels like a heating system that runs pipes to every room in your house. When those pipes narrow from glucose-related damage, the heat does not make it to the far end of the house. That room stays cold no matter how hard the furnace works. The cold is not about the weather. It is about the pipes. The American Heart Association identifies peripheral artery disease, caused by narrowed blood vessels, as affecting over 8 million Americans, with diabetes being the single largest risk factor. Cold feet are one of its earliest and most consistent symptoms. The best response here is a 30-minute brisk walk every day. Not a casual stroll, a purposeful, arm-swinging walk. This drives blood circulation into the feet and lower legs, strengthens blood vessel walls, and over time can help reverse some of the early narrowing. Start with 10 minutes if 30 feels like too much. The important thing is to start today. Sign number 9, and this is the one almost nobody ever discusses. I have never seen it in a patient brochure. Most people walk right past it, including many physicians. But once you know it, you will never miss it again. I almost never have to bring it up because patients rarely notice it on their own. But during a foot examination, when I look at the lower legs and the tops of the feet, sometimes there is a visible absence of hair in those areas. The patient looks down and says, "Huh, I never noticed that." And that is exactly the problem. It is a quiet sign, easy to overlook, but it carries real significance. Hair follicles require a steady supply of blood and oxygen to function. When circulation is significantly impaired by long-standing elevated blood sugar, the follicles in your feet and lower legs gradually stop receiving what they need. Over time, they stop producing hair entirely. That hair loss is a visible marker of blood vessel damage that has been progressing, in many cases, for years. Think of hair follicles like small plants in a garden. When the irrigation line narrows or gets blocked, the plants do not die immediately. They just gradually stop growing. The absence of growth is your body sending a message about the state of your blood vessels. A message you can see every time you look at your legs. Research published in Diabetes, Obesity, and Metabolism found that hair loss on the lower extremities correlates significantly with peripheral vascular disease in diabetic patients, a reliable and frequently overlooked sign that physicians are specifically trained to check for. Right after this video, look at your lower legs and the tops of your feet. If the hair is noticeably thinner than the rest of your leg or absent entirely, schedule a blood glucose test this week. Not this month. This week. Roughly $12 at any certified lab, covered by Medicare for most of you. $12 can change the entire trajectory of your health. We have covered a lot today. 9 signs, 9 chances to catch something before it catches you. And I want to be straightforward with you about something. One of the most difficult parts of what I do is sitting across from a patient who has had every single one of these signs for 2 years and is only now finding out what they meant. Not because they did not care. They cared deeply. They simply did not have the information. You now have that information, and I want you to do one thing with it. Just one. Tonight, before you go to bed, sit down and look at your feet. Take 30 seconds. Look at the skin. Look between the toes. Feel for numbness. Check for any wound that should not be there. 30 seconds. That is all I am asking. And if you see or feel anything from this list, please call your doctor tomorrow. Not next week, tomorrow. Because the earlier this is caught, the more completely it can be managed, in most cases through a change in diet, a daily walk, and a conversation with your physician. You have worked hard for the life you have, for your independence, your health, your ability to do what you love. Do not let something as manageable as blood sugar take any of that away from you, simply because nobody told you what to look for. Now you know. If this was useful to you, share this video right now. Send it to someone you care about, a family member, a friend, a neighbor. You might be handing them something they did not know they needed. And if you want more conversations like this one, I post new videos on this channel every week. Topics that matter for your health after 60. Things I discuss with my patients that most people never hear outside a doctor's office. Subscribe, and bring someone you love along with you. I'm Dr. Dan Carter. Stay aware, stay proactive, and take care of those feet. I will see you in the next one.